Let's get more on that Medicare story. The AMA Vice President Stephen Parnas joins us now in the studio. Stephen, thanks for coming in.
Good morning.
You're going to be heading down to the emergency ward of St Vincent's Hospital after this. What is that going to mean for the emergency department, a move like this, do you think?
Well, I think it would be a flow-on effect from the impact that general practice will experience as of Monday. And we've said that if you undermine general practice, you affect the entire health system. On Sunday, a type of consultation where you see a GP and the episode of care takes less than 10 minutes attracts $37.05 in a Medicare rebate. As of Monday, that drops by more than $20 to $16.95. And so we're concerned that that will have a number of devastating impacts, actually, on primary health care.
So are you saying that it will happen straight away?
We need to see, because I think a lot of people are unaware of the changes that are taking place. They've just been announced before Christmas. They're being implemented in the middle of January.
So right now, for those kind of visits, someone turns up, sees the doctor and walks out the door?
For many, they do. There are others for whom there are co-payments attached. We've always encouraged doctors to charge what they see appropriate, but doctors are also very mindful of what their patients can afford, and we are particularly concerned that these changes will most adversely affect those people on lower incomes.
Some people argue, though, that doctors are double dipping. They will get a patient, they'll send them off some tests, they come back and ask to see the patient when they could easily do it over the telephone, thereby getting an extra payment, that additional payment again. Is that not a factor in the reasoning behind this kind of change for those shorter visits?
Yeah, I don't think so, and I say this because yesterday the Prime Minister said that this is about improving quality. It's actually not. It's really about trying to pull back over $1 billion into the budget. That is their first priority there, and what we're concerned about, our first priority as healthcare, is that this will actually undermine the provision of care.
Are there circumstances where doctors rush through patients and don't spend that quality time with them?
Well, there's the potential under duress for people not to spend time if circumstances compel them to do so. What I would say is that doctors almost always put the patient first and spend whatever they need to spend with them in terms of time. As I said, the bottom line for the profession is the care that's required. What we're worried about is that tens of millions of consultations where this would apply are going to be dramatically undervalued, and when you have that $20 drop, then if you want to keep your business open as a GP, you will go into the red if you absorb this cost. You'll have to pass it on.
And how do you feel about the political debate we've been reporting this morning that this appears doomed in the Senate?
Well, our first call is to the Prime Minister to say reverse this decision now. Don't let it come in on Monday. But if the government goes ahead, then we will continue to put pressure and argue the case with all senators, government, opposition, crossbench, and say to them, when you return in February, please disallow this motion, because I think a number of them are already understanding that this has fairly devastating impacts on primary care. It's the most efficient part of the system, and if you undermine it, it's going to cause much more expensive care elsewhere, such as hospitals.
We are facing enormous budgetary constraints. We've seen the budget deteriorate dramatically over the last couple of months. Where would you point the government to in terms of savings and where they could be made?
Well, that's a matter for government. What I would say is, as far as health goes, which is the AMO's domain, is that government expenditure as a proportion of budget has not been going up over recent years.
But it needs to go down if we are not getting as much income.
Well,
surely.
I would say that the government has to prioritise. Isn't politics about making those decisions about where priorities are? I would say that most Australians regard their health as their number one priority, and if you pull money out of it, you can guarantee that it's going to be undermined, but you also need to protect those efficient areas, and to see a GP costs a hell of a lot less than it is to see specialists like me in a hospital.
Have you had discussions with the Minister?
We have. We've met Minister Lee on her first day coming in, but she's new to the job. She's had a break over this time, as a lot of people have. but we're going to have further discussions with her and the government. At this stage, given the urgency of the matter, we've also asked for an urgent meeting with the Prime Minister. Our President, Brian Owler, wrote to the Prime Minister last week saying this is urgent, please reverse this decision, please meet with us, because it's going to have some fairly serious impacts very quickly.
What was the discussion when you did meet with Minister Lee? I know they have taken a break over the summer. It appears that some haven't, because there's been lots of lobbying going on with those senators. And those initial concerns that you raised, how were they received?
Well, it was day one when she was sworn in as a minister, so we've got to be fair about these things. But we appreciated the discussion. But I think both the government and the AMA recognise that these things have to be talked through more clearly. And as I've said before, if they announce policy without consulting with us, then they shouldn't be surprised when this level of antagonism is brought about.
Now, this was brought in before the legislation was actually introduced, which is why this is this odd situation where it's going to start before there is an ability to vote down the legislation. Is there another backdoor way this could happen if it is defeated in the Senate? Well,
the government will look at whatever they can do to get their measures through. We're going to have to do whatever we can to keep pushing that message that we've got to protect the system and try and improve it where we can, but not denigrate it. Now, when you've got regulation changes, which is what this is, then the Senate has the right to disallow those regulations. We'd have to wait and see what the government, what their next step was.
And if doctors spent over 10 minutes with a patient, then that hasn't been hit as hard, that payment, that Medicare rebate, has it?
It hasn't, but then if things go as we expect, on 1 July there will be a $5 reduction for everyone except concession card holders, children, aged care residents and veterans. So the $16.95 for many people, most, would go to $11.95. So you can imagine that's why GPs are horrified by this. We've seen unprecedented feedback on this issue. The most
and
I've
it hasn't
seen in
even
a
come
decade.
in yet. The patients are almost not aware of it just yet.
It's everything from despair to rage, I have to say.
Stephen, thank you very much for joining us.
Thank you.
Now, we did ask several government ministers to come on this morning, but none were available. Yesterday, the Health Minister, Lee, issued this statement. Labor's announcement that it will turn its back on measures encouraging doctors to spend more time with their patients is a sneaky backflip, all about politics, not patients.
It continues. For the past 8 years in opposition and government, Labor have talked and talked about the need to deliver better health outcomes for patients and end 6-minute medicine, but have never delivered.
And finished by saying as recently as December, Labor had signalled its desire to see our health system move away from such a model.